Good morning, everybody. So glad to be back with you again. Kind of a soggy, cold morning here, but at least it's not white, so nobody's complaining about that. I am so happy to have Lauren Taylor with us today. She is a nurse practitioner, certified oncology nurse, and is leading the walk-in clinic at Fort Wayne Medical Oncology and Hematology. Good morning. Great to be with you.
Good morning, and great to be here. Thank you, Lee.
So I don't know a lot about cancer care. I am so fortunate. Nobody in my family, direct family, really has been through this. I don't have any real firsthand experience with this. So there's a lot I don't know. And I know many of you in the audience out there listening may be in cancer care or have some experience. And if you have questions, you may be smarter about this than I am. So don't hesitate to give us a call at 447-1190, 800-333-1190, or you can text your question to 46862. So where you would put the phone number, just put 46862. It will come to us, and we'll put that in front of Lauren Taylor. So tell me, you've been in cancer care now for 10 years.
Yes.
What's really changed in the past 10 years?
Oh, there has been a lot of changes. Oncology is a very, growing, very rapidly changing field. As far as treatments go, we are seeing more and more targeted therapies. We are seeing more oral treatments. So patients are able to do their treatments at home rather than coming to the office in some cases. We are seeing a lot more genetic testing, genomic testing, which can personalize their treatment more for them. A lot more immunotherapy treatments, which have a whole different side effect profile than the traditional chemotherapy that you would think about, that we've all are so familiar with. So just getting used to those different toxicities and things that you can see with these treatments, and just being able to target treatments specifically for patients so that it is more personalized. And
so by that you mean you're taking a look at not just what type of cancer I have.
Correct.
But you're looking into the individual cancer cells to understand what medications are going to best attack them?
Yes, that's exactly right. So, we can actually check, the tumor itself for mutations in the genomic makeup or even in their genetics. And specific mutations will actually work better with different treatments than what what we used to traditionally treat them with. We have found that, there's not a one-size-fits-all for each cancer. So.
And that personalized treatment goes beyond just the medications or the protocols you follow these days. I understand that everybody's focusing on making this whole experience more personalized to the individual. What does that mean?
Yes, so we personalize the treatment for each patient to work with what's going to give them the best quality of life for them. What is each patient's goal of treatment? What's important to this patient, and how can we keep their priorities in mind as we create their treatment plan? What are their biggest concerns? Are they most worried about finding transportation for their treatments? Are they worried about, okay, how can I make this treatment work with my work schedule, because I'm going to have to continue working throughout my treatment? So just trying to be able to create a treatment plan that is not going to interfere so much with their personal life, and be more doable and supportive of each patient.
I get it. So instead of this is how we do it, how do we need to do it for you?
Exactly.
And that's where the walk-in clinic comes in. So this is a relatively new offering you have. Explain for me what we're talking about here.
Yes. So the walk-in clinic, it's a very exciting new development for Fort Wayne Oncology. We are open from 8 to 10 in the morning for walk-in patients, so you don't have to have an appointment. If you are having a toxicity from treatment, meaning a side effect that is just not controlled, just kind of, I don't think I can wait till my next appointment to talk to someone about this. I need to be seen, today. They can come in without an appointment. The remainder of the day from 10 to 4, we will make same-day appointments for patients. So patients who call in talk to our nurses and have an issue, and they're not sure, is this something I need to go to the emergency room, or is this something that can wait, or I can help to sort of triage those situations, and we can give them a same-day appointment instead of sending them straight to the ER or having them wait, till next week to be able to get in and see someone.
I think you touched on an important point there, and that is if the emergency room is my only option for immediate attention in a cancer case, that has a lot of negative consequences.
Absolutely.
I have seen studies that show you're not going to get the same level of care at the emergency department because they just don't know you. They don't have your imaging. They don't have all your files immediately. They don't have all that history that you do. And secondly, and this is the big one that matters to all of us, and that is cost.
Yes.
The cost of cancer care is going up. Not much we can do about that. So steps that are going to minimize the cost of cancer care to Medicare, Medicaid, all of us pay that cost, right?
Absolutely.
So tell me more about what might bring me to same-day kind of care. You said toxicity. So is it a new treatment that might go off the rails, or something I've been doing that suddenly is not working?
Interestingly, it can be either one. It can be a brand new treatment that your body is struggling to become accustomed to, and we need to help you figure out how to manage these side effects you're having so that you can tolerate the treatment better and stay on it without any issues. Or it might be a treatment you've been on for a long time, and all of a sudden your body's just getting worn out and tired, and you need a break or some more recommendations. So instead of sending you to the emergency room where your immune system could be compromised from many of the treatments that we prescribe, we don't want you exposed to all the other illnesses that are bringing people to the ER if we can avoid it. So coming to our office where you can be seen quickly, you can be seen by someone trained in oncology. We work alongside the oncologists from our offices, and so we have access to all of the notes, labs, testing, and everything that's been done.
So pain is something that everybody thinks about when it comes to cancer. Can you help me? Give me an example of people who come to you for a pain scenario, and what can you do?
Sure. So sometimes patients will have a pain from their actual cancer diagnosis, and it can be tricky trying to get you on a regimen that will alleviate that pain. It can take a lot of adjustments and things. So being seen, just once a month or so, sometimes that's just not enough. And we need to see you more often, and we don't want you sitting at home in pain waiting for that next appointment. So you can come in and I can help with adjusting those medications or trying something new. There's also cancer treatments that sometimes will have side effects of muscle, bone, or joint pain, and so making recommendations as far as those go too.
We are talking this half hour with Lauren Taylor. She is a nurse practitioner and a certified oncology nurse who now is managing the walk-in clinic, an appointment-free clinic for patients of Fort Wayne Medical Oncology and Hematology. If you have cancer and have just an urgent need, there's no sense to wait to your next appointment.
Right.
That's the whole mission here, is to get you in and get you seen as soon as possible. And we just during the break there were talking about the impact of COVID on cancer patients. Man, it's got to have been a rough road.
Oh, it has. It has. It's affected our patients with their treatments and appointments, just having to limit visitors that can come into the office with them. We are to the point now where we can allow patients to have a visitor when they are coming in just to see the doctor or an advanced care provider for appointments. But we still can't allow visitors back in the treatment areas, and that's hard for patients. Especially during this pandemic, but it does seem to have brought a sense of community with our patients, which is nice. The nurses and the patients do seem to be developing more relationships and things as they are, more apt to talk to the staff as well as the other patients. A lot of times we'll see them visiting with each other, which is always a really nice thing to see, just that sense of community. And
yeah. That is, you are going to be, if you have cancer, you're going to be a series of appointments over time. Mm-hmm. It really is a relationship thing with you care providers, isn't it?
It really is. It definitely has a family feel. We get close with our patients, and it's very important to us that they feel comfortable coming to our office. Cancer is such a distressing diagnosis, and treatment can be very stressful as well. And we want them to know that our office is a safe place for them, that they can come to us with their concerns, they can talk to us about what they're going through so that we can better help them and through their journey.
We are going to be seeing a big increase in the number of cancer cases in the years ahead as all of us, I'm in that peak of the baby boom years, about to hit 65, and that is when a lot of cases start showing up. Yeah. So it's going to get very busy. We're all going to see more cancer as we move forward, so it's great to hear there have been so many advances. Mm-hmm. Part of that comes down to managing the rest of my physical health during treatment. Mm-hmm. What can you do to help me if I'm so severely fatigued during this process? How can you help me there?
Absolutely. So we really encourage healthy lifestyle interventions. So we really push for good nutrition, making sure that you're getting enough protein and calories in your diet. Weight loss and decreased appetite, unfortunately, are common effects from cancer and cancer treatments as well. So really pushing for good nutrition. We have access to dietitians for help with counseling. We can recommend nutrition supplements, things like that. We also encourage exercise, physical activity to help with fatigue and energy. Healthy sleep habits, making sure that you're getting adequate sleep, napping when you need to, but also trying to stay active as well. Keep your metabolism going, keep your muscle mass as much as possible, and just taking care of yourself. If you smoke, trying to stop smoking, and we have programs where we can help you with that. We're always there to try to encourage people with their healthy habits, and we have great resources we can recommend for patients as well.
I have a text question here for you. My 50-year-old brother is receiving immunotherapy for kidney cancer. I want to be supportive but not intrusive. Any suggestions?
Sure, absolutely. That is a tricky situation, and the best thing to do is communicate. Communicate with your loved ones and say, hey, I want to help any way I can. Just being open and honest and having that conversation and hearing from them what you can do for them, whether that's offering to drive them to an appointment so they don't have to, if they're tired or fatigued, they don't have to worry about that burden. Offering to, bring them lunch after their treatment, or just even calling them the next day and seeing how they're feeling and whether you can bring them anything. Those are all really great ways to support people.
I'm guilty of being a little bit too aggressive about conversations with health issues. I dive right in and get all the details. Are cancer patients typically, what do you see in them? Are they comforted by talking about their care, or, hey, this is my deal, I really don't want to share?
It's a good question. I see both sides of that. So there are some patients who do just need to talk about it, and it's something that they've had held inside, and just don't want to burden other people with talking about it, and think that people get tired of hearing about it. So opening up those conversations, hey, would you like to talk about this? Just giving them the option to open up, or to say, oh, no, everything's going okay. Leave it up to them whether they want to have that conversation or not.
So your clinic is, just to recap quickly, no appointment necessary, 8 to 10 a.m., 10 to 4, same-day appointments are available.
Yes.
What do you say to patients about when to take advantage of that?
Sure, absolutely. So anytime that you're having a side effect from your treatment or a symptom from your cancer that's not well controlled, you can come in. So a lot of those symptoms would be, if you're having nausea, vomiting, issues with diarrhea, constipation, problems with staying hydrated. If you're feeling dehydrated, real tired and weak, things like that.
Well, just let me pause on that a second. What makes dehydration so common among cancer patients?
Well, dehydration can occur very, very easily in patients who are feeling nauseous, and so they're not eating and drinking enough. Patients who are having diarrhea, you can just quickly become dehydrated. Also, patients who are having taste changes, things taste like metal or things taste, salty or bitter. They may not, want to drink. And we are able to offer IV fluids at our same-day clinic. So that is something that we can offer for patients when they're feeling tired, weak, possibly dehydrated. So we can check lab work there. We can determine whether they would benefit from IV fluids, even IV nausea medications, things like that.
So we talked a bit earlier about the advancements in personalized therapy, and immunotherapy is one of those. If I am using immunotherapy, am I going to have... What are the side effects going to be, and how does that compare to chemotherapy?
That's a very good question. Immunotherapy is very different from chemotherapy. Immunotherapy, the drug is actually teaching your immune system to fight the cancer. And so the side effects that we see with that are not the typical, nausea, vomiting, hair loss, things like that you would expect with chemotherapy. Instead, with immunotherapy, it's more of, you might see some fatigue, maybe some mild muscle or joint pains, things like that after your infusion. There are instances where the immunotherapy can cause inflammation inside the body. It can occur with any organ in the body. So it's important that we monitor labs regularly before each treatment to make sure that you're not having any liver toxicities, kidney toxicities. We assess for inflammation in the lungs, so shortness of breath, cough, rashes, just any organ in the body can be affected by it. That doesn't mean that it's common and that it's going to happen to everybody, but those are just possibilities of things that can happen.
So do typical anti-inflammatories work to relieve those symptoms, the muscle pain, the discomfort, that kind of thing?
A lot of these toxicities that can happen with immunotherapy can be reversed with steroids. We try to avoid using steroids unless we absolutely have to, because it can inhibit the effectiveness of the immunotherapy.
Sure.
So we reserve that for when they're absolutely needed. So that's why close monitoring is so important, so that if we start to see the beginning stages of one of these inflammatory responses occurring, we can either give the patient a break, maybe back off a little bit, so that we can prevent from getting to the point where we have to treat them with steroids.
We've got just about a minute left. I want to know, what do you see, what's the common trait in people who do really well in cancer therapy?
I would say having a positive attitude, positive outlook, good support system. It goes so far for patients who are going through treatment. People who are willing to ask for help, who are willing to come in and talk about what they're going through so that we can better help them. That is the absolute best thing that you can do to be successful with your treatment.
And you can do that without an appointment.
Yes.
From 8 to 10 a.m. And then a same-day appointment from 10 to 4 at Fort Wayne Medical Oncology and Hematology. Of course, you have to be an FWMOH patient to have available for that. But it's a great service that's out there, and I wanted you to know about it. And Lauren, thank you so much. Appreciate you being here.
Thank you, Lee. I appreciate it.
You bet.